Having a hard time raising your iron levels? I'm going to tell you 3 reasons why and how to fix it. My name is Dr. Tom Rofrano from the Natural Medicine Clinic in Palm Beach Gardens, Florida. And most of our patients come in with gut and thyroid issues, many of whom have either too low ferritin or high ferritin, which represents your stored iron levels. This one particular patient, woman in her early 50s, came in and she had low ferritin levels. It was at a 7 for 3 years, and even though she was taking iron, she wasn't able to get it better, and she wanted my help. So the first reason why her iron levels weren't improving was because she was taking the wrong type of iron. So her primary doctor found out she had low ferritin of 7, told her to go and get some iron. So the most common one people get is ferrous sulfate, 65 milligrams. She was taking that, and it has very low absorption rate. It also can cause a lot of GI, a lot of gut symptoms, so a lot of people stop taking it. I recommend iron glycinate. It is much more absorbable and has very little GI symptoms. And the second reason for your iron not improving is not taking it for a long enough period of time. So even though it had been 3 years, she took it for a period of months. Her doctor retested her. Her iron was high, so he told her to stop taking it. Well, even though your iron and percent saturation is high, her ferritin was still low. So your iron can be high because if you took an iron supplement within the last day or two, your iron levels can be high. But until your ferritin comes up, which represents your stored iron levels, you need to keep taking it until you get your ferritin to the ideal level. And thirdly, not finding out the root cause. What is causing your low iron levels? They sent her to GI doctor, did endoscopy, colonoscopy. There was no bleeding there, nothing going on there. Sent her to a gynecologist, no issues causing excessive bleeding there. So she was at a loss. So when she came in, I did some comprehensive testing to find out the underlying root causes. She had the common symptoms of low iron: fatigue, forgetfulness, lack of focus and concentration, gut symptoms of bloating, constipation, hair loss, which is a common low iron symptom, and she was unable to lose weight. So after doing some comprehensive testing, we got her results, and she had a very high gluten sensitivity, leaky gut. She had bacterial overgrowth, yeast overgrowth, and inflammation in her intestines. So all that leading to malabsorption. And she had some other nutritional deficiencies as well. So typically when you're deficient in iron, there are other deficiencies that go along with that. So she had a number of others, including selenium, which is important for the thyroid, and she has a thyroid condition, Hashimoto's autoimmune thyroid, so selenium is very important for that. So how are we going to fix the malabsorption issue? Well, I put her on a specific diet. I call it the free diet because it's not only free of gluten, but gluten, grains, sugar, yeast, dairy, eggs, soy, legumes, nightshades, processed foods, all those foods most commonly responsible for inflammation, leaky gut, and other chronic health issues. Put her on the proper supplements besides the right amount of iron and the right type of iron. So iron glycinate, I had her on almost 120 milligrams a day. So we have a 29 milligram form of iron glycinate. So she took 4 a day of those. And some supplements to help heal her gut issues, the other nutrients she was deficient in. So she came in after a month's time, and not only had her symptoms improved, she had more energy, better focus and concentration, gut symptoms cleared up. Her hair loss was at least 50% improved, she said, and she lost 8 pounds in that 1 month period of time. And then her ferritin level was up to a 29, which was 400% higher than it had been in the prior 3 years. So that was a major improvement. We still have a ways to go there. We want to get it to at least 50, 60 in that range. So she was well on her way to getting better. So to recap, 1, you want to take the right type of iron. 2, you want to take it for a long enough period of time, get retested regularly to make sure you're at that right level of ferritin, and then just don't stop suddenly when you get there. You can reduce the dosage accordingly, but not necessarily just stop. And 3, finding out the underlying root cause. Most commonly, it's related to gut malabsorption issues, often gluten sensitivity. So I believe if you find out the root cause and are provided the right solutions, that most anyone can get better. So I'll leave you a link below of the free diet phase 1 food chart, and feel free to like and subscribe to my channel, and I look forward to seeing you next time. Take care.